Welcome to VOCABRIA and REKAMBYS, the first and only complete long-acting regimen for HIV-1 dosed once every 2 months. What is VOCABRIA and REKAMBYS? VOCABRIA and REKAMBYS is the first long-acting antiretroviral regimen available for the treatment of HIV-1. VOCABRIA contains the active ingredient cabotegravir, and REKAMBYS contains the active ingredient rilpivirine. VOCABRIA and REKAMBYS is administered as 2 separate gluteal intramuscular injections at the same appointment, and has demonstrated efficacy with an every 2-month dosing regimen. Data from 2 phase 3 studies shows that VOCABRIA and REKAMBYS, injected once a month, has non-inferior efficacy to daily oral antiretroviral therapy through 48 weeks. In addition, in another phase 3 study, every 2-month dosing of VOCABRIA and REKAMBYS demonstrated non-inferior efficacy to monthly dosing. How do the formulations of VOCABRIA and REKAMBYS allow for every 2-month dosing? What are the differences in pharmacokinetic properties between VOCABRIA and REKAMBYS long-acting and an oral daily regimen? VOCABRIA and REKAMBYS suspensions are administered as gluteal intramuscular injections, typically using a 23-gauge 1.5-inch needle into the gluteus medius muscle. After injection of the long-acting formulations, a drug depot forms in the muscle. From there, the medications are slowly absorbed from the depot site into the bloodstream. Therapeutic concentrations of both drugs are attained within 1 day of injection, reaching maximal concentrations after approximately 1 week with ongoing absorption over the dosing interval. Slow release from the depot yields an absorption-limited half-life of at least 40 days, versus approximately 40 hours when compared with oral dosing of the drugs. Administration of both medications will provide continuous antiviral coverage that lasts over the duration of a 2-month dosing interval. Orally administered drugs result in daily fluctuations of peak and trough levels and provide coverage over a 24-hour dosing interval. The persistence of therapeutic concentrations of both VOCABRIA and REKAMBYS over time allows for less frequent dosing compared to oral therapy without compromising efficacy. This persistence also enables flexible dosing up to 1 week before or up to 1 week after the target treatment date. As this route of administration bypasses the GI tract, there are no dietary restrictions or requirements, and any drug interactions that would occur within the GI tract will be eliminated. With the slow rate of absorption of the medication from the depot into the bloodstream, VOCABRIA and REKAMBYS provides continuous drug coverage over a 2-month dosing interval. In summary, VOCABRIA and REKAMBYS is the first long-acting regimen for the treatment of HIV-1 infection, delivering the efficacy you've come to expect from daily therapy and preferred by 98% of trial patients over daily oral therapy.